So here we look at some of our exercises here, and we look at a traditional crunch or sit-up, and gravity's down. I'm doing trunk flexion, and that can be a combination of just purely trunk thoracolumbar flexion or a little bit of hip flexion that's happening as well, so like an anterior pelvic tilt, and that's against gravity. So this is a concentric activity, and so I'm seeing trunk flexion. These are the flexors contracting, which is kind of converse to what we saw if I was standing doing trunk flexion. If I was standing and I bent forward to kind of touch my toes, that's going to be an eccentric activity of the extensors. A plank position. This is an isometric contraction, so there's no movement, but there's a tendency for movement. Gravity is down, and if gravity had its way with this model, you would end up with the pelvis going to the floor, which would basically be creating extension at the hip and extension at the spine. That's not happening. That's what wants to happen because there's an isometric contraction. Remember, in analysis, isometric and concentric are the same. So if I'm resisting gravity in this downward movement, right, the arrow should be up. That's is a contraction of the flexors, right? And if I look at here, if gravity had its way down, this is what's going to happen. But this is what I'm doing. So if I'm doing this, if I'm in extension and hip extension, that means I have contraction of my trunk flexors and hip flexors to keep me in this position. And it goes back to why do you do this exercise in the first place? You do this because you want to work the abdominals and the anterior musculature. So you kind of want to look, you still again want to analyze what motion's occurring, what joints, and what muscles would be involved. In this case, it would be bilateral obliques, both internal, external will be bilateral rectus abdominis and your hip flexor chain. If I look at a side plank, same concept, right? Gravity's down. If gravity had its way, it would push my hips to the side, so I'd be doing like a hip abduction there. So that's lateral flexion of the spine. It would be the equivalent of right lateral flexion that my body wants to do, but I'm not doing it. Again, it's an isometric contraction. There's no movement. What's keeping me from going in this position are the lateral flexors. And again, if we look at here, if gravity had its way, that's what's going to happen. But I'm overcoming that, right? So these muscles here are lengthened down here. These muscles up here are shortened. In order for me to get back into that position, I need to shorten these muscles. So it's going to be lateral flexors here as I kind of depicted in this position here. So you can go back and watch this video a couple times to try to get an idea of the musculature. Again, in a plank position, it's going to be the anterior musculature that are supporting some scapular stabilization and some hip stabilization from going into extension. From flexion, lateral aspect, you're going to get the lateral flexors, quadratus lumborum, hip abductors, all coming in to maintain this because this wants to come down. This is going to lengthen. So everything here is shortening to pull that back. That's what you're kind of seeing here, latissimus dorsi, hip abductors. And again, I know we're not in the unit, but we're looking at hip. This wants to come down into flexion. So it's the glutes and the thoracolumbar extensors that I am contracting in order to do this position. And then our famous or infamous, when you go down to touch your toes, yes, you're seeing flexion through the entire kinetic chain. You're seeing pelvic movement, hip flexion, lumbar flexion, thoracic flexion, cervical flexion, but your flexors are not on at all. This is an eccentric activity, and if I come up from this position, you can appreciate that it's all this extensor muscles working, hip extensors and the hamstrings, but going down, it's an eccentric contraction. To get the anterior abdominal musculatures, you need to do a trunk flexion. You need to do trunk flexion, hip flexion against gravity. So when you come in and do this, you're doing rectus abdominis, all four obliques, transverse abdominis, hip flexors, so psoas, iliacus, rectus femoris. The difference between a crunch and a sit-up is the crunch is only looking at trunk flexion, whereas a sit-up is involving a decent amount of hip flexion. So when you do the hip flexion, whether it's the leg moving this way, as I said earlier, you have the psoas coming in. Hip flexion is involved in a posterior pelvic tilt. You're counteracting that. It wants a hip flexion and an anterior pelvic tilt are the same, so same musculature. And so you need to engage muscles to do a posterior pelvic tilt to counteract that anterior pelvic tilt that's happening. And if you don't have strong enough back muscles, you're going to go too far into an anterior pelvic tilt. And if you have some bulging discs or some issues there, it's going to create some stress through that kinetic chain. So that's why sit-ups have been labeled as kind of a risky exercise for the back. It's not. It's just got to be risk versus benefit in that component. If I look at trunk rotation, like I showed in the previous slide, so he's doing left trunk rotation here. That's going to be ipsilateral internal oblique, contralateral external oblique, transverse abdominis, rectus abdominis to stabilize, but that's primarily what's happening. And then you're getting a little bit of shoulder protraction on this side and shoulder retraction on that side. So you're going to get rhomboids here, and you're going to get your serratus anterior and so forth there. If I look at extension, particularly bilateral, I'm getting hip extension and some hamstrings and from the glutes, and then all of my trunk extensors are coming up. So my erector spinae, my transverse spinalis group, quadratus lumborum, and my latissimus dorsi, anything that attaches that thoracolumbar fascia that's on the posterior side is going to be involved in that. And then if I look at my rotation, same thing. Right rotation, in this case here right rotation, I'm getting same side erector spinae, opposite side contralateral transverse spinalis. I'm doing right trunk rotation, which is going to be doing external rotation of the hip of the left side. So I'm going to get my external rotators connecting here. And then you have your anterior musculature. So if I'm doing right trunk rotation, it's going to be ipsilateral internal oblique and contralateral external oblique. Of course, don't forget the head movements as well in terms of contralateral and ipsilateral. So that's really where knowing the muscles are going to come from. Is you only have the 3 planes of motion, but you have things coming from cervical, capital, thoracic, lumbar, and the pelvis, and keeping track of anterior, posterior, lateral musculature, who's involved. And I think these 3 slides really are these four positions, like the trunk flexion, trunk extension, trunk rotation, and then standing rotation, incorporating the pelvis into the mix. And that's where a lot of the muscular analysis is going to be. And that's where I would study or focus your time, is appreciating who's contracting as agonist, antagonist, and during what type of positions. And don't forget, are you going with gravity or going against gravity? Because that will change the movement. If it's a concentric joint action and it's an eccentric activity, it's going to be the opposite muscles. It's going to be the extensors, even though you're seeing flexors. If it's a flexion activity and it's concentric, it's going to be the flexors.